Hi there. Today we will be discussing healthcare reform initiatives between Minnesota versus Wisconsin. Now, the world is becoming smaller and smaller, and Rasmussen Healthcare Systems is looking to expand their original footprint to another state. So, with that, we will discuss Minnesota and Wisconsin's take on healthcare reform. Minnesota taking on its medical assistance program and Wisconsin implementing Badger Care Plus, as they are both part of Medicaid, which is state and federally funded program. Both programs have a specific purpose, and they both also have similarities and differences between the two. The final portion of this presentation will discuss the overall recommendation on whether Rasmussen Healthcare System should switch to Wisconsin's Badger Care Plus program. Now, let's discuss Minnesota's medical assistance program. Minnesota has a multitude of healthcare reform initiatives in the works. However, Minnesota has developed Minnesota's Medical Assistance Program, a program funded by Medicaid, which is both state and federally funded. Medical assistance is a program designed for low-income individuals, but also serves children and families, pregnant women, adults without children, seniors, and people who are blind or have a disability. The benefits of this program can include services like doctor visits, prescriptions, and hospital stays. And for some members, there is no cost, but others may have to pay a portion of the cost of service, which could include copays, deductibles, or spend downs. Essentially, the benefits of Minnesota's medical assistance helps reimburse healthcare providers for healthcare services for eligible recipients. Medical assistance purpose is to provide healthcare center services, inpatient hospital services, lab and x-ray services, physician, nursing facility services, and even pregnancy-related services. Let's discuss Wisconsin's Badger Care Plus program. Now, Wisconsin also has a multitude of healthcare reforms in the works, but more specifically, their Badger Care Plus program is a connection to the healthcare coverage program designed for Wisconsin's low-income residents. The purpose of Badger Care Plus is a program designed for children, pregnant women, adults, which can also include adults who are 18 through 25 who were in foster care when they turned 18. The services Badger Care provides is checkups, immunizations, prenatal care, and other preventative and wellness doctor visits. It also includes emergency department visits, hospital care, maternity and newborn care, mental health, behavioral health, and substance abuse treatment. Badger Care also provides prescription drugs, rehab services and devices, as well as lab visits and x-ray services, and even vision care. Badger Care Plus works with healthcare facilities in Wisconsin that will provide healthcare for people with little or no health insurance. Most of these facilities provide primary care and preventative care to people of all ages, regardless of their ability to pay. The healthcare facilities charge for services on a sliding fee scale that is based on your family's income and size. Essentially, Wisconsin provides Badger Care Plus to ensure 98% of Wisconsin residents have access to healthcare, to ensure that every child in Wisconsin has access to affordable health insurance, as well as providing health insurance to more parents and caretaker relatives, and provide enhanced benefits to more pregnant women. Here at the bottom it says funded by Medicaid, both state and federal. Badger Care Plus is funded by Medicaid, which is state and federal program. Now, what are states' healthcare reform differences between the two? Well, Minnesota's medical assistance program and Wisconsin's Badger Care Plus have both similarities and differences when it comes to their versions of Medicaid programs within their states. The difference between the two has shown substantial data released based off the analysts focused on 2019 premiums and deductibles. As of 2019, Governor Walker's refusal to build on the Affordable Care Act is forcing Wisconsinites to pay thousands more for health insurance on the individual market. In some high-cost regions of the state, Wisconsin families are paying over $24,000 more a year. Based off the comparison statewide between Wisconsin and Minnesota, the Badger Care Plus program is paying 50% higher in premiums and deductibles than Minnesota. That's more than $3,781 more per year in Wisconsin on average. In Eau Claire alone, for a family of 4, it is $24,000 in annual premiums and deductibles. Differences in healthcare reform continue between the two states. Cynthia Cox, a policy analyst at the Kaiser Family Foundation, said regulation also plays a role in premium levels. And in Minnesota, regulators have forced insurers in several cases, to resubmit lower rates because they questioned the justifications for them. In Wisconsin, regulators took a more hands-off approach and let all the rates go through as is after reviewing carriers' justifications. Citizen Action CEO Robert Craig and researcher Kevin Kane wrote recently that the fundamental difference between the two states, which are similar geographically and demographically, and have very similar underlying medical costs, is that Minnesota has embraced the national healthcare reform law and is using the tools it provides to deliver more affordable health insurance, while the Walker administration in Wisconsin has tried to undermine the law at every turn. Now, there's a lot of similarities, and the similarities here, although both programs have provided a multitude of differences, they both share similarities. Both Minnesota Medical Assistance and Badger Care Plus provides healthcare coverage to low-income individuals, but also serves children and families, pregnant women, adults with children, and seniors. Both programs also provide services such as prescription drugs, rehab services and devices, as well as lab visits and x-ray services and vision care. Should Rasmussen Healthcare Systems expand to Badger Care Plus? Well, based off careful observation of evidence between Minnesota's Medical Assistance Program and Wisconsin Badger Care Plus program, I would not recommend Rasmussen Healthcare expanding to Wisconsin's take on Medicaid's Badger Plus program. Although both programs have similarities, research has shown that financially, Wisconsin's Badger Care Plus program ends up being more expensive than Minnesota's Medical Assistance Program. Both programs provide very similar purposes. Financially, it would not make sense for a low-income family/individual, even a pregnant woman, to switch from Minnesota's Medical Assistance to Wisconsin's Badger Care Plus program. To conclude here, the overall purpose of both Minnesota's Medical Assistance and Wisconsin's Badger Care Plus program was to provide healthcare services to low-income individuals, as well as children and families, pregnant women, adults without children, seniors, and even individuals with certain disabilities. Services could include prescription drugs, rehab services and devices, as well as lab visits, x-ray services, and vision care. Both programs were Medicaid funded by both state and federal help. Thank you so much for your time. Feel free to ask any further questions you may have here at the end.